Good afternoon. I'm Tom Hudaka with the Utah Department of Health, and we will get started with today's COVID-19 media briefing. We have one speaker today. That's Dr. Angela Dunn, who is the state epidemiologist from the Utah Department of Health. Dr. Dunn will be providing us with a situational update.
Okay, good afternoon. We now have 6,362 cases of COVID-19 identified in Utah. That's an increase of 111 from yesterday and just a 1.8% growth rate. We've tested over 150,000 people for COVID-19. Over 4,000 of them were resulted yesterday. We're still at a 4.2% positive rate overall. 517 individuals have been hospitalized due to COVID-19 and 92 are currently hospitalized. We are now up to 68 deaths due to COVID-19. That is an increase of 1 from yesterday. This individual was a resident of Salt Lake County, a male who was an older adult, less than the age of 60 years, and was hospitalized at the time of his death. So the governor announced going from red to orange statewide on May 1st. We've been in orange for just over 10 days now, and we've maintained a plateau in our cases. We continue to have ample hospital capacity and stable testing numbers. This is a sign that people are taking our public health recommendations seriously. Social distancing when possible, teleworking if possible, wearing masks in crowded places, using good hand hygiene, and staying home when ill. For those who are at high risk for severe disease due to COVID-19, it is still important to take extra precautions. If you fall into a high-risk category or you care for someone who does, and you need additional help like meal, grocery, or medication delivery, we now have a hotline that you can call into. The number is 1-877-424-4640. That operates Monday through Friday from 8 a.m. to 5 p.m., and it's answered by representatives from our Department of Human Services who have specific resources for our high-risk populations. Happy to take some questions.
Hi, yes. Dr. Dunn, you mentioned orange, and obviously there are some places in the state that are looking into the possibility of moving to yellow. Mm-hmm. I know you've mentioned the hospitalization rate and transmission numbers as some of the reason behind it, but I guess, is there a target transmission number, like people who are, transmitting the disease in certain areas that needs to be reached before a region would be allowed to move to yellow?
Yeah, so it's going to depend on kind of what their overall transmission rate is. We recommend a local transmission rate of below 1.25 to consider moving into lower colors or less restricted colors. But again, that's going to depend on the kind of overall context of the local jurisdiction. So like you said, taking into account hospitalization rates, what their growth rate has been previously, because we certainly want to make sure that we're not moving jurisdictions into, for example, yellow when they're starting to see an increase in their number of cases, regardless of the transmission rate. So we take this whole holistic picture of what's happening in each jurisdiction before making those recommendations, but transmission rate is part of that.
Hi, Dr. Dunn. 2 questions for you today. One, the governor and the Department of Health is encouraging the use of masks, but people still are not taking that recommendation seriously, especially in the stores, and they're not following the unidirectional flow inside the stores. So can you explain the scientific evidence supporting the use of masks and following unidirectional flow? And then the second question would be, you've talked about it before, but when someone tests positive for COVID-19, what's your recommendation for their roommates or their family members? Should they be self-quarantining themselves, or can they still be out and about in the community?
Sure. So for face coverings specifically, face coverings help protect others from your own droplets. So it's important for individuals when in situations where you can't avoid, being in close contact with others. It's really important that everyone has a face covering on so that germs are not spread from person to person. So it's really about keeping others safe. There is evidence out there of pre-symptomatic or asymptomatic spreading of COVID-19. So face coverings will certainly help prevent that asymptomatic spreading of COVID-19. In terms of the unidirectional flow within stores, that is just a way to engineer social distancing so that within a store where you're more likely to come into close contact, less than 6 feet between people, it's really important to have as many engineering controls as possible within a store to prevent that from happening. So that unidirectional flow will help with that and avoid the spread of COVID-19 in retail establishments. In terms of if you're positive and you have roommates or family members living in close quarters, the ideal situation is going to be having, the person who's positive be in their own bedroom and ideally within their own bathroom as well. If they're ever within close contact with any family member, everybody should have face coverings on. Again, that's to prevent the spread of COVID-19 from the infected individual to the other individuals in the household. It is recommended that the entire household remain quarantined until everybody feels better. We do know that those living in close contact with a positive case are more likely to become positive themselves. So in order to prevent the spread of COVID-19 among community members, we recommend that everybody be well before any individual leaves the household apart from quarantine.
Hi, Dr. Dunn. I'm looking at metrics on rt.live, which is a website created by Instagram founders that track the transmission rate of COVID-19. And here in Utah, it shows we're hovering close to 1.0, which I understand from their website, they explain it as this number means the rate of transmission is still spreading quickly. So my question to you is, what kind of COVID-19 rate of transmission could we be looking at if the economy continues to reopen? Are you concerned it will be above that 1.0 transmission rate? And also following up with that, what could transmission rate numbers look like by fall if we continue where we are with current trends?
Sure. So transmission rate, again, is one indicator that we're using to track the pandemic. What it means, so a transmission rate of 1 means that for every sick individual, they're likely to infect one other individual. So a 1.0 transmission rate is good. It's definitely a decrease than where we started this outbreak. And that's largely due to social distancing measures. So the further we are away from people and the less people we come into contact with, the less ability we have to infect others. What we really are aiming to do for this pandemic is to get to a transmission rate of less than 1. That's how you know that it's getting under control. That means that your case rate is decreasing. And so you're seeing a decrease in cases from every day. And that's really an important place for us to get to. That won't be able to be stabilized until a lot of people have immunity to COVID-19, either to get from getting the disease themselves or from a vaccine. So we do have a little ways to go in terms of getting that transmission rate less than 1 for a really stable period of time. As the economy starts to open up and people start to have more contact with individuals, we in public health are definitely preparing for a transmission rate that will increase. That's just by the nature of being into contact with more people as social distancing restrictions relax. We're hoping that our messaging around, good hand hygiene, mask wearing and staying home when ill, and maintaining quarantine and isolation if you're recommended to by public health will allow us to keep that transmission rate as close to 1 as possible as we balance the public health crisis with the economic crisis.
Thank you so much. And is that transmission rate, could that look good or bad by fall?
Yeah, we're certainly hoping that it will continue to stay close to 1 and drop below 1 by fall. Again, that's going to largely depend on the impact of decreasing social distancing measures as we move forward. This is something none of us have done, so it's something we're going to keep our eye on really closely and adjust our policies accordingly.
Okay, so could you tell me a little bit more? So RT.live, it's saying that our transmission rate is about 0.97 as of today. Is that pretty accurate to what you guys are measuring yours with?
Sure. There's a few models that are using Utah-specific data that are a little more localized than what RT uses, what that website uses. Our models show anywhere between 1.1 to 1.3 right now. So it just depends on the data coming in. We have access to a little more timely data than that website does. But they're all kind of within the range of error.
Thank you so much. I appreciate it.
Dr. Dunn, hello. Two questions. First off, do you favor, hang on a second here, I had it down. Do you favor proactively testing all residents and staff at long-term care facilities? And does Utah have the facility to do that? And then secondly, about 10 days ago, we talked about the strike teams that the state had that was sending to different places. Wanted to find out how many strike teams are out there right now, and where they're deployed, and what they're up and what they're doing at those places.
Sure. So we currently have a statewide plan right now to work with long-term care facilities to get their staff tested if they do not have an identified case of COVID-19 in their facilities. So those plans are underway. Something we've been doing all along throughout this outbreak is that any long-term care facility that has an identified case of COVID does complete testing of staff and residents. So we are already doing that, and we certainly have the capacity to continue doing that. It is a priority in our response here in Utah. In terms of, what was your second question?
Talking about the Utah strike teams that, that were first deployed about 10 days ago.
Sure.
How many of them are out there right now?
Sure.
Where are they being deployed, as much as you can say, and what are they doing?
So we haven't had the need to deploy additional strike teams. Currently, we've deployed them to Utah County, specific to a long-term care facility incidents there, and then we've had mobile testing surge in our Navajo Nation down in San Juan County, but we haven't had the need to do additional at this point.
Okay, thank you.
Sure.
Yeah, Dr. Dunn, Ben Winslow with Fox 13. Just where are we at on the curve? You said we've been plateaued, but is it looking, based upon what you're seeing with positive cases, testing, and all of that, are we going to be plateaued for a while? The governor has said that, hey, in a perfect world, we'd be moving to yellow by the end of this week, but it doesn't look like that based upon some of the dashboard we're seeing by the Utah Department of Health.
Yeah, I mean, we've definitely maintained a plateau for a couple of weeks, and that's a good sign. We are looking for that decline, and that's just something we haven't seen yet. So we're really working hard to do that, and some of the tactics we're taking are those strike teams that were already mentioned, identifying hotspots really quickly and moving to contain the spread. Because of our lower case counts, we're having the ability to definitely be more efficient at those hotspot interventions, and so hopefully that'll start showing up in our curve and seeing a decline.
But at this point, no plans to move to yellow by the end of this week?
Not that I know of.
Thank you.
Hi, thanks, Dr. Dunn. Roger McDonough with KCPW Public Radio. I've got a question that I imagine you already addressed in an earlier briefing. I'm not positive, but my apologies if this is rehashing old territory. At the beginning of last week, one of the members of the state's COVID-19 Community Task Force, Representative Paul Ray, in a Facebook post that has been shared more than 1,000 times now, called for a full reopening of Utah, saying a couple of things. First off, that this wasn't much worse than the flu. Also, that basically you could see people dying anyway as a result of economic depression from the measures being taken. And then finally, that not as many people are dying of this in Utah as die of other things, heart disease, suicide, and so on. And I would just ask for your response, Dr. Dunn, to the request for an immediate and full reopening of Utah by Representative Ray.
Sure. So we can't separate the public health crisis from the economic crisis. They go hand in hand. This is, of course, first a health crisis. We certainly can't just open up the economy if people feel scared to go out and they don't even go to a restaurant. So we need to make sure that we're containing the virus enough so that the public has confidence that they can go out safely and not get infected. We at the health department are acutely aware of the impact of economic strain on the health of individuals and families, potentially for generations to come. So this is something we are certainly striving to end this pandemic as quickly as possible to limit that economic hardship. Again, we don't see these as two competing priorities. It's something we have to address together and moving hand in hand as we move forward in this pandemic response. I know that our case counts have been low and our death rates have been low because we've taken very early and proactive responses here in Utah to prevent the spread of COVID-19. And we're in a good space because of that. And it's allowing us to creatively open up our economy in kind of the slow roll way to ensure that we consistently balance the health and the economics of this. So we're doing the right thing here in Utah, and I'm confident that we'll be able to manage both the health and the economic side moving forward.
Just in terms of how contagious this is and in terms of how deadly it is as compared to the flu, can you address that part of Representative Ray's claims?
So it's really not comparing apples to apples. COVID-19, of course, is caused by a novel virus that we do not have treatment for. We do not have a vaccine against. For flu, we both have a vaccine and treatment for. We also can't predict COVID-19 and how it's going to spread and who it's going to impact in the same way that we can predict our annual flu epidemic. We've had annual flu epidemics for decades, so we're good at being able to predict it. Even though we can predict our flu epidemic every year, it still annually causes a strain on our hospitals and our ICU. So those are the best case scenarios. You've got the flu that has a vaccine and treatment, and we can predict it, yet it still strains our healthcare systems every single year during flu season. With COVID, we don't have a vaccine, we don't have treatment, and we can't predict it. So it's something that we have to take these social distancing measures in order to really prevent the spread of COVID-19.
Thank you.
Hi, Lindsay Whitehurst with AP. I was wondering if you had an update on the Healthy Together app, how many people have downloaded it, whether it's been able to identify any positive cases and help with that contact tracing yet.
Sure. So just over 40,000 individuals have downloaded the Healthy Together app. We don't have a public health portal built yet. We are in discussions with the company every day to build that public health portal. But up until this point, it is serving as a way for individuals to assess their symptoms and get referred to testing if that's appropriate.
Hi there, Nick McGurk from ABC4. Thanks for taking my question, Dr. Dunn. Can you confirm that last week was the deadliest week here in Utah? How should we feel about that? And also, can we touch on the antibody testing? How's that going? And what is that telling us about the state of coronavirus here in Utah?
Yeah, sure. So, I mean, death is definitely, the most tragic part of any pandemic, especially this one. And seeing that increase definitely points to the need for us to continue with our vigilant response as we've been doing. We're hoping that our decrease in cases this week and at the end of last week will lead to a decrease in deaths in the coming weeks, and so that the trend will follow in deaths and that we will start seeing a decrease. And that's what we're working towards. What was the second piece of your question?
I guess, how should folks feel about that? Because I know nationally it seems as if, states are reopening, but cases seem to be surging in some places and deaths seem to be climbing by the tens of thousands.
Sure.
And I know Utah's a different place, but
Yeah.
It's just, I guess, how should folks feel about how things are going here in Utah, given the state, I guess, locally and nationally of this virus?
Sure. So death again is the most lagging metric we can track. It's what happens at the end of a COVID-19 illness potentially. What we're looking at in order to inform policy are those metrics that happen before death, so that we can prevent additional deaths. And things like case counts are something we're tracking. And the fact that our growth rate has been decreasing over the past couple of days and that we've seen a plateau in cases is a good sign moving forward. And it's also a sign that a decrease in deaths could follow as well. A big push to decrease the mortality rate due to COVID-19, of course, is working with our long-term care facilities. About half of our deaths are due to long-term care facility outbreaks. And as was mentioned earlier in this press briefing, working to get long-term care facilities tested even if they don't have a case will help us achieve that goal.
And the other question, I guess, which is probably what you were asking about, was just antibodies. How's the antibody testing going? Is that telling us anything about our overall numbers and spread here in Utah so far?
Sure. So we don't have any conclusive data yet from antibody testing. The University of Utah is conducting a statewide survey of antibody tests and currently have deployed to a couple of counties, but we don't have definitive numbers yet or results from that. I think what we can use antibody testing for moving forward is a little unclear, because given the low prevalence, the low case numbers we have in Utah, the chance that an individual gets a false positive is very high, meaning that the antibody will show that they had been exposed to COVID-19 in the past when in fact they hadn't. So it's really essential that we work with our healthcare partners and our laboratorians to deploy antibody testing in a meaningful way, and that's what we're doing.
Hi, Dr. Dunn. It's Ashley Imlay with the Deseret News. Regarding the southern Utah counties that have requested to move to the yellow phase, how likely is it request or other requests from counties in the future will get granted at this point?
Sure. So it's my understanding that those counties have decided to not push for that at this point. We're currently reviewing the data with them ongoing to identify the indicators that could suggest that they could safely move down to yellow. But I don't believe there's any current request out there right now.
Thank you.
Okay, thanks, Don. This is Chris Free with St. George News. Southern Utah, you mentioned about the state itself overall plateauing 1.8% growth rate. Southern Utah, especially Washington County, was very much an outlier over the weekend. The growth rate here was right around 4.8%.
Yep.
And all of a sudden, St. George specifically is among the moderate high range for case rate. So with that, what do you attribute that to, number one? And could it be possibly that it's right at the entry point of other states that have more strict restrictions, like Nevada and California and Arizona?
Yeah, so we're working with Southwest Health Department right now to identify the reason for the surge. There have been a couple of localized outbreaks that have contributed to an increase in cases in the Southwest area. The point about kind of have they occurred potentially due to visitors, we haven't found that to be true yet, but it's something that we are working to track to understand that implication of tourism and increase in growth rates. Okay, thank you guys so much. Have a great afternoon.
Gotcha. And one other quick question. Do you have any data?
Okay, go ahead.
I'm sorry. I'm sorry, Dr. Dunn. Just one more quick question. You mentioned about the transmission rate overall, I think right around 1-to-1 statewide. Do you have any data on the transmission rate specifically in southern Utah or Washington County?
Yeah, so to be able to estimate transmission rates, you need a lot of data to be able to do that in a informative and way that we can have confidence in. And our local health jurisdictions, especially down in the Southwest area and others, just don't have enough data coming in for us to be able to estimate that. So we're using other indicators such as hospitalizations and growth rates to be able to inform the policymakers there.
Thank you so much.
Okay, have a good afternoon.